Dr. Brown is pretty interested in is that CBD is an accepted foundation for clinical research. In your opinion, is that the best approach rather than trying to go forth with NIDA to say we would like to do an investigation on the benefits, medical, clinical benefits of marijuana, because the term is so antagonistic to law enforcement and other individuals who've had bad experiences or heard things such as reefer madness? Your opinion, is this an accepted foundation for clinical research?
The first thing I'd like to say is that in my sub-circles, we don't use the word marijuana anymore, we use cannabis. Mm-hmm. So any studies that might be instituted should use the word clinical effects of cannabis, not marijuana.
Okay, so terminology is a very important word.
Cannabis is an herbal plant species, and we're investigating the effects of medicine that's been around for 5,000 years.
Yes.
So that's one thing. The second thing is, certainly the effects of CBD should be investigated, but what we've found clinically is that the best effects as a medicine that we see are plant matters, extracts that have both CBD and THC and other components of the marijuana plant embedded in it, such as the terpenes. So the thing about herbal medicine that often Western medical physicians don't understand because they've been trained in drug medicine is what Dr. Ethan Russo, who writes about this topic a lot, calls the entourage effect. And that is the ability of the plant medicine to access a multi-level potential of cellular interactions with the different components of the plant as nature makes it. So there is a disconnect here between the way that doctors and government officials are trying to categorize this herbal medicine in terms of its constituent drugs. Mm-hmm. And my personal opinion is that we should look at it as an herbal medicine and look at the value of the mix of the different components and how we can maximize that mix for effects in people, not to separate it. Having said that, there are many laboratories that are studying the effects of CBD, cannabidiol, in culture, in animals, in other countries, in people, and it's giving us a lot of important information.
That's great. Well, that's one of the points of clarity that should be very important to people in the public, in the profession, and the trades, and who serve these patients, is that by rearranging the terminology and usage, then we speak in the same language rather than to let them foster further antagonism to the usage. In other words, let's put the label on it that it deserves and to use it. The other question that is pretty striking amongst many patients in that, are there independent studies being conducted in the present in the Southland or anywhere within the United States?
Studies on the efficacy of medicine?
Yes, and its components.
There are some studies. There are several that have been published by very stalwart individuals who have made it through the multi-levels of NIDA and DEA and FDA approval. There are some studies. One of the doctors who's been the author of many of these studies, his name is Dr. Donald Abrams, and he works out of UCSF. And that's the gold standard study. He's made it through all the levels, federal, state, local, published in reputable journals. And there is a moratorium on approval for those studies currently. So there's a problem with that. There's a real problem with that.
Well, apparently, if there's a moratorium, there seems to be something coming forward.
The moratorium stems from the fact that the only approved NIDA source of marijuana is not allowing that source to be used in studies. There are several studies backed up that actually have all the approvals they need from the other regulatory agencies below that level, but they can't get the substance.
Wonderful.
There are some other studies that came out of California recently in the past 10 years, funded by the CMCR, Center for Medicinal Cannabis Research, that the California state government funded through the UC system. And they have published, several of their results already. Their studies are done, and they ran out of money, so there aren't any new studies being done. But those studies are available. CMCR report is available, and they found a lot of benefits for cannabis for neuropathic pain, for other kinds of pain. They did some studies into vaporized versus alternative roots, things like that. So those have been published. Right now, it's very difficult to get any studies approved in this country, and I don't know anyone who is succeeding.
Well, that's a detriment to the public and the benefits that could be coming from this product. I mean,
but what I would like to say is that there are ways around this, and the problem is funding.
Mm-hmm.
As medical director of a group of medical clinics called Medican, when in my capacity as medical director of that group, we actually got an IRB approved to study the effects of topical cannabis medicine for pain, in which the patients themselves would bring the medicine to the study. In that case, we don't have to depend on the federal government to provide the medicine. And the patients themselves were going to bring their medicine from a standardized source, and were going to be enrolled with a placebo, which had the same components, but without the cannabis in it. And that is an alternative way to get studies done, where the patients bring their medicine to the study, and it is a standardized medicine. That we can do.
well,
That particular study didn't go forward for reasons that had to do with what was available through the institution I was working with, the company I was working with, but that's still a viable way to continue cannabis research. Patients providing the medicine, not the government.
that seems very feasible. In fact, it's commendable that it can be done. It is. It's absolutely. Is there a demand among patients that CBD can serve? In other words, as a wide group, I mean, and should it be available to them OTC, or should it be more in the sense of with the clinician who listens to their history, reads it, and recommends it?
In all the cases of high CBD medicine used by patients that I'm working with, which is many, it does seem to work better if there's a little tiny bit of THC present. So as far as utilizing a 100% CBD medicine, it's good for anti-inflammatory uses, good for anti-epileptic uses, it's good for anti-spasmodic uses, and there may be some uses for that, but it's limited in its use to specific categories. It doesn't have as widespread a use for pain, for example, as the mixed product. So there are some things that CBD, pure 100% CBD can be used for. That should be legal. There's no THC in it. And the definition of marijuana is something in this country that has more than 0.1% THC.
Yes.
So, yeah, there's definitely some use for CBD medicines.
Wonderful. In closing of this, is there something that you can recommend to the average patient and consumer who is considering an alternative medicinal therapy or clinic in their repertoire for their prophylaxis and treatment of pain? Is there something you can recommend to them to have them either, like you said, is bring their own product for the study, or is there something they can do out there to help foster a bigger awareness as to the need for this product?
Well, we're in a transition state with cannabis as a medicinal entity. patients don't have enough information, doctors don't have enough information, providers don't have enough information. I think the best thing that can happen is for more communication to happen between all these groups. Because people are using cannabis, but how they're using it and what's working is not getting relayed to the general population. Providers are making cannabis, giving it to their patients, but they don't have the expertise to ask the right medical questions of what improvements are happening. Physicians are recommending cannabis, but there's an issue about them being associated with any providers. So there is a lot of information. California has approximately a million medical marijuana patients. There's a lot of information, but there's not enough communication. So that's what I see needs to happen next. There's more communication so the information that we do have can get out there.
Well, that's wonderful. Thank you very much, Dr. Mal.